A 7-year-old child is brought to the emergency department with signs of severe shock. The child is lethargic, with a heart rate of 160 bpm, blood pressure of 70-40 mmHg, and a capillary refill time of 5 seconds. The child has a history of recent fever and vomiting. The decision is made to intubate the child due to worsening respiratory distress and altered mental status.
What are the risks associated with intubating a child in shock?
Intubating a child in shock is considered a high-risk procedure due to the increased likelihood of cardiopulmonary arrest during intubation. Hemodynamic instability can be exacerbated by the vasodilatory effects of induction medications, myocardial depression, and changes in cardiopulmonary interactions with positive pressure ventilation.
What pre-intubation assessments should be performed to minimize risks?
Before intubation, it is crucial to assess myocardial function, acid-base status, and volume status. Optimizing these parameters can help reduce the risk of cardiopulmonary arrest. This may include providing additional preload, correcting hypocalcemia and metabolic acidosis, and initiating catecholamine infusions.
Which induction agents should be used with caution, and why?
Induction agents with potent vasodilatory effects, such as propofol and barbiturates, should be used with caution due to their potential to exacerbate hemodynamic instability. These drugs should be titrated rather than administered as a bolus.
What is the role of ketamine in intubating a child in shock?
Ketamine is a useful induction agent in hemodynamically unstable patients, including children in shock, as it is associated with fewer hemodynamic complications. However, it does have negative inotropic effects, so careful monitoring is necessary.
What considerations should be made regarding Autodate?
Autodate can help maintain blood pressure during intubation, but it has adrenal suppressive effects, which can be particularly concerning in septic patients. This should be considered when choosing an induction agent.
Cardiogenic shock. The onset of action for medications may be slower due to prolonged transit times and poor perfusion. Additionally, patients with altered mental status may require lower doses of induction medications. Incremental titration with a lower dose may be warranted to avoid further hemodynamic compromise.